H1N1 swine flu. The CDC is soon going to release new figures based on revised calculations showing that an estimated 4,000 Americans have already died from the virus. That's 3 times the previous estimate. 40,000 have been hospitalized. The reason for the higher numbers? Health officials are now counting deaths caused by complications related to the flu. Here's Lisa Stark.
The new numbers expected from the CDC will be based on a computer model looking at surveillance systems that the CDC uses to track influenza, systems such as hospitalizations, lab testing, and emergency room visits. It does not mean that deaths have gone up sharply. It is just a more accurate snapshot of the toll of the epidemic. The best protection remains the vaccine, and there are still long lines to get it.
We will be out of vaccine by the time we get to this part of the line.
Here at Sanofi Pasteur, they are working 24 hours a day, 7 days a week. This is the only company that is making the H1N1 shot in the United States and has produced half of the nation's supply so far. Sanofi had promised 20 million doses by the end of October, but delivered only 17 million.
We assumed 50% of historical yields. Surprisingly, it was actually only 30% when we started. So the differential was not that great for us, and we've been able to close that gap.
Health officials blame that on the vaccine companies.
What we were doing is relying on the manufacturers to give us their numbers. It does appear now that those numbers were overly rosy.
But at Sanofi, they insist, once they realized production was not going as planned, the government was fully informed.
We've had 30 consecutive weeks discussing this with them. And we've kept them very much informed in terms of what we felt our production schedule could be.
Sanofi says its production is now at full steam and it will soon be ahead of schedule. But for most of the 159 million Americans at high risk from H1N1, the wait for vaccine continues.
Unfortunately, the consequences of not having enough vaccine soon enough is we're going to have people who are going to necessarily get sick and some will die.
But Sanofi insists today, not for lack of trying, saying it will deliver its promised 75 million doses before the end of the year.
And one of the reasons it takes so long to get out vaccine is all the testing. Sanofi says samples from each batch undergo 50 tests, everything from strength to how well the vaccine will work to its purity. Critical tests, but it all takes time.